Certainly this year, as the last 2 or 3 years, it's a meeting this time about immunotherapies. And it's probably a meeting more of fine-tuning some of the data we have seen, the exciting data in melanoma, renal cell or lung cancer. I want to highlight a few things, particularly in the area of GI cancers where Sarah has been heavily involved, especially around gastric cancer. So patients with PD-L1 positive gastric or Gastro-estrophageal cancers doing extremely well. We have an interesting presentation here with a drug called Avelumab, a PD-L1 inhibitor in patients with gastric cancer, and so interesting results to be seen and shown here on Sunday. And then certainly what is really exciting is the patients with mismatch repair gene defects. There's several presentations here. Generally mismatch repair gene defects appear in about 3 to 5%, but in some cancers like colorectal cancer, we find this in around 5%. And a mismatch repair deficiency means that genes are screwed up, cancer cells producing extensive antigen into the blood, and this can be recognized by T cells. By blocking this with PD-1 or PD-L1 inhibitors, there's an opportunity to particularly target this. And first indications in some cancer patients have been presented a few years ago now, but now the randomized studies, the kind of larger patient population, especially in MSI positive, mismatch repair deficient colorectal cancer, really exciting data where we see for the first time progression-free survival, overall survival data. So patients who are mismatch repair deficient or MSI high have a survival rate of about 60% at 2 years, response rate about 60% in colorectal cancer. So really exciting data, which we don't see in these patient population if we just treat them with normal chemotherapy. So I think that's really exciting where we are involved. Phase 2, phase 3 studies rolling out now, and hopefully confirm what we see in these very early but expanded patient populations right now.